Annual health checks are a must, and we recommend certain blood tests and ultrasound related tests for anybody who is above the age of 35, because we can do an early detection of certain metabolic diseases like diabetes and hypercholesterolemia. And specifically for women, 2 tests, the pap smear test for screening of cervical cancer and the mammogram for screening of breast cancer is extremely important. Pap smears, once the patient is sexually active, can be done, and if it's negative, it can be done 3 years later. But for mammogram, anyone between the age of 45 to 54, annual mammograms are recommended.
Menopause is always a retrospective diagnosis. When you don't get your periods for 1 complete year, following that you call yourself menopause. But perimenopause is actually about 3 to 4 years before the actual menopause sets in. That's when you start developing symptoms of menopause. Usually it can start with, it's the biological process. Majority of them will sail through it without experiencing any symptoms, but some can present with irregular periods. They can have hot flushes, night sweats, mood swings, irritability, lack of sleep, mood disorders. They have absolutely no energy, and recurrent urinary infections can also occur with menopausal symptoms. How do you treat menopause? Menopause is part of life. As far as concerned, if the symptoms are troubling you, then you get back to your doctor and explain all your symptoms, so the doctor will treat you either with non-hormonal medications, or if the symptoms are pretty bad, they might, considering all your risk factors, start you on some HRT.
First of all, in premarital, that is in the teen age groups, the urinary tract infections are quite common because due to the menstrual cycles, improper hygiene. So you need to maintain a good hygiene, frequent change of pads and frequent urination, and avoid postponing urination. And in case of sexually active females, it is due to the sexual activity. So you need to empty your bladder before intercourse also and after intercourse also, and maintain a good personal hygiene, and also maintain good hydration and high fiber diet. In postmenopausal women, it's usually due to the estrogen deficiency. So in that case, you need to have to visit a gynecologist or a urologist and get yourself evaluated and get treated accordingly.
Women need to take their supplements, especially postmenopausal women, select postmenopausal women need to take their calcium supplements. Vitamin D deficiency is also more found in women as compared to men, so yes, women need to take their vitamin D supplements. A childbearing woman should be taking folate, and a lot of women are found to have deficiencies in different vitamins and minerals, so the suggestion is yes, please take your supplements.
As a clinical dietitian, I will not recommend keto diet, because in keto diet we have to include more of fatty foods in our diet. This fat in longer run leads to kidney diseases, so I strongly don't recommend keto diet.
Osteoporosis is a condition where there is a decrease in the bone mass as well as the density, which leads to weakening of the bones, which may further causes a fracture without any lesion. Even a trivial fall can cause the fracture. The symptoms of osteoporosis are back pain, neck pain, muscle cramps. The cramps usually comes in the night time, which will disturb your sleep. Loss of curvature of the spine. There will be a change in the posture, what we call as the elderman's pose.
Diagnosis of osteoporosis is, one is you can make a self-diagnosis where you have a probability when you think you're osteoporotic, where your body weight is very, very low for your age and you've been losing body weight. These are the few things where you can come to a doctor to know if you're osteoporotic or not for checkup. As a clinician, the best way to diagnose whether you're an osteoporotic patient or not is by a bone mineral density scan. Usually we do of the hips and the spine, and that's the most accurate way to diagnose osteoporosis. Once you're diagnosed with osteoporosis, it's the patient specific what you have to do and what the doctor should do. So I would say more what you need to do is you need to eat well, give lot of proteins to you, you need to eat lot of proteins, diets more in magnesium and zinc, that's supposed to help in osteoporosis, and most important is strength training. That is very important. Maybe everyone will tell you take this, take that, but I would say exercise, body weight strength training, eating a specific diet rich in calcium. Coming to the medications part of it, we put you on some what we call bisphosphonates, where you have tablets, injections to be taken. Now there are a few very good medications in the market to increase the bone density per se. So where we give every 6 months one injection. So there's a lot of options where you can discuss with your clinician, and he will tell you what is best for you.
Osteoporosis is not related to only family history. Osteoporosis can happen to any age group. Osteoporosis can happen to any sex. But one of the most common age group which get affected is women in their 40s or beyond 40s. Because after 40 years of age, usually their body will start losing estrogen. Estrogen is very much responsible for to maintain the calcium or bone density in the body. As the estrogen will go down, the calcium, the absorption of calcium from the food will reduce it, which leads to osteoporosis. One of the most common people who can get affected are women who are beyond their 40 years of age group, who are doing excessive amount of exercises and not taking care of their nutrition, and those who are doing smoking, drinking, lot of amount of smoking or drinking, that can lead to osteoporosis.
In elderly people, as you become aged, usually what happens is you change, there is a change in your posture, like your shoulders become rounded, your neck and your back becomes little curved, and you also have different shift in weight bearing. So because of this, falls are very common in elderly people. To prevent falls, what you have to do is you have to strengthen your whole body, starting from your neck, your shoulders, your upper back, your lower back, especially your core and your abdominal muscles, which is very important, which especially is the upper body which holds your trunk, which we call it as the trunk. And also you have to do a lot of exercises for your hip, knee and ankle, and in your house, like it has to be, decluttering has to be done.
Only doing continuous cardiac activities and no involvement of the strengthening led to a weakness of the muscles, weakness of the bones, which further led to a complication like a stress fracture. So it's always advisable for not to do only the cardio, not to do only aerobic exercises, not to do only high intensity training. Always include strength training along with that.
Intermittent fasting is safe for weight loss. Those who have pre-existing diseases like diabetes, thyroid and any hormonal issues, I strongly recommend not to do intermittent fasting. An healthy individual can do intermittent fasting. It's 16 hours of fasting and 2 meals a day you can follow.
See, breast examination should be done by all women above the age of 18 at least once a month. It is called a self-breast examination. A lady needs to do her own self-breast examination. But professionally, getting an imaging or ultrasound scan done, like a mammogram or a sonomammogram, should always be done at least once a year for anyone above the age of 45. Now, in this self-breast examination, if any lady feels a lump that was not there before, she needs to get 3 things done. 1 is show it to a breast surgeon and get it examined. 2 is do a mammogram for sure. And 3 is, if required, we do something called as an FNAC or a biopsy. These 3 things are mandatory if you feel there is something abnormal in your breast.
Anemia is very common in women, and a lot of times it's because of blood loss anemia. What you could do to prevent anemia is, 1, take your supplements if you're a known patient of iron deficiency or a different kind of deficiency related anemia. At the same time, have your food that are rich in iron, like you could have your spinach, beetroots, dry fruits, chia seeds, flax seeds, or you could also have other sources of minerals and vitamins that could help prevent you from getting anemia. But if you get fatigued, you meet your doctor.
Certain procedures like scaling, cleaning of teeth, and the simple filling procedures can be done throughout the pregnancies. But procedures such as root canal treatment and extraction, surgical extractions, are taken up and are safe only during the 2nd trimester.
There are 3 categories which we need to avoid during pregnancy. First is papaya and pineapple, which leads to premature delivery. Second is any raw vegetables. You can have cucumber and tomatoes, not an issue, but any kind of raw salads like lettuce, cabbage, broccoli, cauliflower, like that, you have to avoid it. And when comes to meat, you have to avoid raw meat. Then preservatives, any kind of ready-made food, instant food, you have to avoid it.
Over-the-counter fairness creams can contain topical steroids that can damage your skin. So instead of going for over-the-counter creams, it's better to go for a customized skincare routine. So it's a common myth that a lighter skin or a brighter skin is a beautiful skin, but it is not. Instead, a healthier skin is a beautiful skin. So if you need any customized skincare products for your skin type, then do consult your dermatologist.
It is a definite yes to take cervical cancer vaccine. Anybody between the age of 9 to 45 can take the vaccine. It's preferable and more effective when you take it at a younger age, between 11 to 12 years. But anybody from the age of 9 to 26, both girls and boys, can take the vaccine. Is it safe? Yes, it is safe. Very mild side effects you can have after the vaccination. So after the vaccination, we always recommend you to stay there where you take the vaccination in the hospital for about 10-15 minutes. It's definitely effective. It is not 100% effective, but it is 70 to 80% effective than 0%. When you don't take the vaccination, you are at risk